In 2012 and early 2013, Wake County EMS and SAS Business Analytics Software in Cary, North Carolina, teamed up in a public-private partnership to research response time statistics on cardiac arrest victims. The outcome of the study was a groundbreaking discovery that concluded spending 1 hour performing hands-on CPR as opposed to the previously practiced 30 minutes could significantly reduce the amount of fatal cases.
The project was designed to answer a very specific clinical question, and we have been focused on CPR resuscitation here since April of 2005 in a very scientific, evidence-based way, and we had patients who were outside of the parameters. We did not have scientific guidance. We were having to kind of use our best clinical gestalt without any data to support how we were caring for these patients. So the impetus for the project is we've got a group of patients that we need better data to guide us on how to care for them. And the public-private partnership with SAS just makes sense because we've got this complicated database and they've got very good analysts that can help us work through this database. Historically, there were a handful of trials back in what I call the old days of resuscitation, which is where we were doing interruptions and compressions, 5-2 or 15-2 or 5-1 or some ratio where we would stop to breathe. We've now learned you shouldn't do that, and we've learned that you should cool people to protect their brains, right? So we've been doing all of that here since 2006. All of the previous data as it relates to how long to do resuscitation was based in the old days. So nobody has looked in the new days in the out-of-hospital environment. There's been a single paper that looked at the in-hospital environment. And if somebody has a cardiac arrest while they're in the hospital, they saw the same thing. You should keep going in certain situations. And so for us, we are the first community to look at the pre-hospital component and say, what is the optimum time length of resuscitation? We believe this will change the approach across the country. There's nothing magic about the formula here. We are doing what the American Heart Association recommends. They've been recommending since 2010. So other communities can immediately look at these data and say, we should go beyond that old 20 to 25 minute rule in a certain subset of patients.
I've been in EMS for 30 years, and 25 years ago we would go into a house and we would do CPR under the old standards, give medications, defibrillate, and work for 20 to 25 minutes, stopping CPR to check a pulse, stopping CPR to move the patient from one room to another to the ambulance, and then transport to the hospital. Today, we do CPR where we find them. Once we start, we don't stop. We don't stop CPR unless we get a heart rate back. And it has made all the difference in the world.
The importance of this to the community is kind of in two different realms. The first of those is we now know better how to care for someone whose heart has suddenly stopped. And as I said, we are doing CPR once every 18 hours, so it's not all that infrequent. And what we want to be sure of is that the citizens of and visitors to Wake County have the best scientifically sound treatment available for this very important clinical condition. What does this mean? Well, last year we saved over 90 individuals in our community from this problem, and our overall survival rate is among the best that's ever been reported anywhere. And the reasons are our scientific approach. So now we know going forward, hopefully even more can be brought into that category. So that's the importance there. The second piece though, that these data show, and that every single time we have studied this, and every time this has ever been studied, the most important contributor to survival is the immediate provision of CPR chest compressions. And so as a community person who cares about your neighbors, your loved ones, your family, the most important thing you can do is learn that very simple skill so that were this to happen, you can buy us the time that we need to get there and do all the rest. So two things to say. One, these data are just as clear as all the rest. You gotta push on the chest while we're doing all this, and you need to do it as quickly as possible. That's very predictive of survival. And now we know that with all of that nice resuscitation going on in the background, we can go for longer than we thought and still have neurologically intact survival, which is very important.
15, 20 years ago, we got called to a house on a holiday for a cardiac arrest. And did everything that we could, gave the medications, did all the treatments that we could, and in the long run ended up telling the family that we were sorry and we had done everything that we can. A few years ago, when I had a cardiac arrest on Christmas Day, we did CPR, we gave the medications, and we didn't stop. And 30 minutes into it, we had a pulse rate back, transported the patient to the hospital, and later on they were discharged back home. And the family got up with us later on that year and told us that was the best Christmas present that they could have ever had.